Hi, this is Greg Friese, paramedic in central Wisconsin. I get to see a lot of older geriatric patients in the work I do, and I had one that was pretty interesting recently. Maybe like 70-year-old female. She had vomited a few times, felt weak, had a recent history of a staph infection on her lower leg, had some complex medical history. When we arrived, she was very anxious. You know, nobody likes to vomit and uncomfortable and hyperventilating basically. And we tried to calm her, reassure her, and got her so she could talk to us. And we're doing our sample history and asking her questions about allergies. And we got to medications. And I say, what kind of medications do you take? And she said, I take all sorts of medications. I said, well, do you keep a list somewhere? Oh, sure, there's a list in the cupboard. And before we arrived, she must have called like five of her best friends because there's this, the kitchen's just filled with all these about 70-year-old women. So they start tearing through the cupboards trying to look for this list of medications. She says, oh, no, it's not there. It's in my purse. And so we find her purse. And she's trying to go through her purse and she's still vomiting in the emesis bag. And she's trying to reach in. She pulls out this crumpled up piece of paper, hands it to me and says, that's my medication list. And I uncrumple it and I start reading to her. I said, oh, so you take milk, eggs, cat food? No, wait a minute. This is your grocery list, not your medication list. Where do you keep your medications? Oh, they're all in the bathroom. So this little group of ladies goes down to the hall, the bathroom, and they start tearing open the cupboards there. No medications, ma'am. We can't find your medications. So, oh, right. I just got back from Florida. They're still all in a plastic container in my bedroom. So eventually we found her medications in her bedroom after we'd been through this whole process. And many of you as EMTs, paramedics, first responders, have experienced this same thing when you ask patients for a list of medications. And, a simple list is wonderful. Keeping it up to date is a real challenge for a lot of patients. And other things that would be nice to have listed is anything they're allergic to, who their regular doctor is, what kind of medical problems they have. You know this well just as I do. And what I would think would be great for a patient would be a way to organize that. And I've been hearing a lot recently about electronic medical records are coming. Everyone's going to have a thumb drive or a wristwatch where they can beam you their medical records to your ambulance laptop. And sure, that's coming, but a lot of our patients, 70, 80, 90 years old, aren't going to be the early adopters of that electronic technology. What we might be able to get them to use is some sort of simple way to organize that. Something that's come to me recently, this was sent to me by Ann Blanchard, Blanchard Enterprises. Ann developed what she's calling Handirecords. It's a mini file cabinet at your fingertips. And we'll take a closer look at the Handirecords. There's a couple different ways that Ann has put this together. One way is just a really simple one-pager. A tuckable, I think she calls this, that could go into somebody's wallet or their checkbook. More of a billfold style, the handy record itself. And we'll do some close-ups of the handy record, but Ann is included in here, basic patient contact information, allergies, medication, all the stuff that I'm looking for as a paramedic, right? And even nicely supplements, herbal remedies, vitamins, over-the-counter dietary supplement. The other thing that Ann sent me, I'll show you this. You're probably familiar, File of Life, Fact of Life, something that goes on the refrigerator. This is just an emergency information placard. It's got a sticker backing on it, so it could stick on a door, keep it handy. And then in here, this would draw my attention, obviously, as an emergency responder. I can't tell you how many times I've gone into the kitchen and just started rummaging around because the patient says, oh, my medications are in the kitchen. Well, this would help draw my attention. And then in here is a card with that same basic information about the patient.